Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Am I leaving anything out? All right, headache season. Well, I'm going to talk about headaches for another reason. I love treating headaches because the success rate is off the charts. And yeah, it may sound like I'm bragging a little bit, but I get to brag if the results are that good, and they are. And one of the things I want to touch on before I go into all the questions I get is that there are ways to use laser to abort headaches. Okay. Now, there's preventative type of procedures and there's abortive type of procedures. When someone's having a bad headache, let me tell you, you're going to want to have that abortive procedure. And it entails a couple of things. Well, first of all, if you're getting Botox for your migraine headaches or your terrible headaches, the same spots that they're injecting the Botox into is the same spot we can use lasers to inject the energy, the light energy to come photobiomodulation and have it inject the energy so it goes through the nerve and it back feeds to the trigeminal nerve, which is also involved most of the time with headaches. Many times. It's not the only one. There's another spot if we're bored of headaches that we hit the vagus nerve on the ear. So that's just the exciting thing is had someone come in this morning, okay, having a terrible migraine, hasn't had one in a long time, was down, felt down, a little tired, a little fatigued, a little ill. Boom, she gets the migraine. Boom, gone by the time she's out of here. We're talking about a few minutes of treatment to alleviate these headaches. But I guess that's my excitement for today is telling you about it because I was. But let's go over some FAQs about migraine headaches, okay? Migraine headaches face a range of frustrations. And some of the biggest complaints they get about the condition is the severity of pain, the intense throbbing headaches that can make daily activities impossible. Okay? Now, another big complaint that we see is the unpredictable timing of migraines. They can strike at any time, disrupting plans, routines, interrupting your life, work, kids, excitement, everything else can get nailed on this, okay? Now, the other thing is a big source of frustration is the lack of effective treatments. Many find the current treatments inadequate or unreliable. And the other thing, too, is, and this is the lesser degree we see this, there's a stigma of invisible illness. You look normal, you look healthy, you look happy. Well, you don't look happy if you get the migraine. But what will happen is, people around you don't see, oh, well, you look normal. You could be faking it. It's in your head. I mean, I'm sure you've gone to, if you've had migraines in a long time, some of the doctors will try to talk you into telling you it's in your head. So it's a stigma of an invisible illness, and it's challenging to explain the impact to others who don't get them. Got to tell you something. Here at Core Health, we understand these challenges. We offer innovative, non-invasive treatments to provide relief, but also to improve the quality of life. This girl today, her life is that much better. She's texting me in an hour to see how her day went. I'm anxious to see it. I'm pretty sure it went pretty darn good. So what we do here is, Core Health is where my practice is in Darien. We serve all of Fairfield County, and we do a great job of finding natural headache solutions. So it's something for you to consider. And if you do have a question, give us a call, 203-656-3636. 203-656-3636. Give us a call and see if we can help you. Now, another question we get in the FAQs is, how do migraines disrupt daily life? Migraines can significantly impact daily activities by affecting social plans and relationships. If you got a chronic headache, and say you're a woman, your husband's not going to be happy. You're missing parent and teacher meetings because you have a headache. A lot of life goes out the door when you have these headaches. So it's something for us to take a look at. And again, if we can change it, this is going to be a really good thing for you. Now, another thing too is migraines can disrupt your life by causing frequent absences from work or school. There's also, you can't go to work if you don't feel good, and it's understandable. But then again, as we stated earlier, one of the stigma of the invisible illness is you have to explain that you're not fine just because you look fine. So it also, another way to disrupt daily living is difficult to concentrate or complete tasks. When your head's pounding, it's probably a little bit more difficult than you think. So And one of the treatments that we offer here is low-level laser therapy. We're finding to be a great tool for firing up nerves that aren't working properly. Okay, um, the nerve is trying to start. Think you try to start a car and the battery just won't turn over. Well, in some cases, that could be a similarity to what you have going on with what's going on with you, with the nerve and the trigeminal nerve or the vagus nerve causing the headaches. Okay, so some, low-level laser, LLT, cold laser, phenomenal ways to do it. So let's get to the next FAQ. What symptoms do patients find most debilitating during a migraine? Well, this comment, I'm sure this is going to be you when I read them off to you. Sensitivity to light and sound. Mild exposure can worsen the pain. The condition we call allodynia, where little things just make it really, really worse. And so what would typically not be causing you pain can cause you pain. It's a great Scrabble word, Allodynia, allodynia. Nausea and vomiting. They often accompany migraine attacks. You probably know that already if you have them. Aura disturbances. Vision, speech disruptions can make it more difficult to even think. All right. And of course, there's the throbbing pain. That's the hallmark of migraines. So we got a lot of stuff here. So touch upon another one here is how do migraines affect mental health? Well, migraines can increase the feelings of isolation and loneliness. You're going through it. No one else knows what you're going through. Not a fun time. It also contributes to anxiety about when the next attacks will occur. I mean, some people, believe me, I have patients all the time. They're worried about when they don't have it, but they're worried about it. It's pretty interesting because there's not much I can do to, unless I get the headaches to go away completely. That's a tough thing to really, do as far as how anxiety about the next time you have a headache. And it also leads to depression. You have chronic pain affects the frontal lobes, and you can definitely lead to depression if you've got, long-term migraine exposure. All right, let's keep going here. What frustrations do people have with traditional migraine treatments? Basically, side effects from medication. Many treatments can cause unwanted side effects like headaches. It's called a rebound headache. If you're getting a rebound headache, you're going to have a problem, and the medication is only making it worse. Loss of effectiveness. Medications that initially can work stop working after a while or become less effective over time. So you're taking the same pill or same medication. You're hoping it's going to work, but it's not going to because it's no longer effective. Your body's got to adapt it to it. Maybe you need a higher dose, but that's pretty dangerous in and of itself. Another thing is that the cost and accessibility. Some treatments. I mean, Botox is crazy expensive. And it doesn't last. I mean, I think most insurance companies come like 4 times a year. So every 12 weeks you go in and they tune you up with a little bit of Botox, and what it does is it quiets the muscles down. Okay, it kind of freezes or paralyzes the muscle. In a minor way, it does, and that's why people get it for wrinkles. It paralyzes the muscles, so the muscle's not scrunching up, creating the wrinkles in the first place. Now, you got to understand, migraines create financial burdens because the cost for prescription medication and treatments. Another thing, too, to consider is how much lost wages due to missed work days. And also, too, is when you start going to complementary therapies. Now, listen, I would guess chiropractic could be considered a complementary thing. Medication very rarely is going to address the headaches because you got to keep taking the pills. I mean, in a sense, it's a merry-go-round for the big pharmaceutical companies. I urge you. So one of the things we do here is we like to provide long-lasting relief, okay? And there's many different ways we do it. Laser, trigenics, cervical traction. I'm interested in laser. Laser is pretty powerful. So the goal here is reduce the frequency and intensity of the migraines. You alleviate debilitating symptoms like the pain, nausea, sensitivity to light and sound. These are the things that you'll start to look forward to as we start to get successful with your care. We want to avoid the side effects and limitations from medication-based treatments. Every medication you take is going to have some kind of effect on the body. So what we want you to do is reclaim your life and productivity by minimizing disruptions to your daily life. It's time to get your life back. So with 32 years of experience and what we have to offer, if you've got a question, take the first step towards relief. If you're ready to experience life without constant burn of migraines, contact me. 203-656-3636. 203-656-3636. Give us a call. More than happy to get on the phone, talk to you, and hopefully get your headaches to go away. All right, Dr. Brian McKay, Core Health Darien, my podcast, Not Just a Chiropractor, Stanford, Darien, Norwalk, New Canaan. Have a wonderful day.